Welcome to the Mental Health Reform Podcast. Here on Mental Health Reform, we believe in starting important conversations, breaking down stigma, and highlighting the incredible work of those who dedicate their lives to making a difference in the mental health space in Ireland. Today, I'm delighted to introduce our new Chairperson of the Board of Mental Health Reform, Dr. Judith Malone. Judith brings a wealth of experience in psychology and mental health leadership, having served in senior roles both here in Ireland and internationally. Her career reflects a deep commitment to improving systems of care, strengthening professional standards, and advancing the rights and well-being of people living with mental health difficulties. I'm honoured to have her guiding the organisation at such an important time, and I'm really looking forward to hearing her reflections on her journey and her vision for the work ahead. So you're very welcome to the show, Judith. Thank you very much.
Thank you, Stephen. It really is a privilege to be here.
Well, I guess I personally would be very curious about the start of your journey. Coming from Canada, what drew you first to mental health work, and maybe by extension, what continues to fuel that commitment?
Yeah, that's a great question, Stephen, because it's a little bit different for each of us in that journey. For me, I'm just naturally a very curious person. I have unquenchable curiosity, really. And so I first went into psychology and looking at mental health work so I could have a better understanding of myself and others. That's where a lot of us start, really. And then I started to get excited. There's so much we do not know about human behavior, about neurobiology. And there's potential in that, tweaks to improve our lives, our communities, our groups. Now that sort of with my personality led me to become really enthralled by potential and solutions. So what can we do? What can we do about suffering, about mental health, about the ways we get along with one another? And that really naturally led me into community development work and into psychology as a profession. I have served volunteer boards since I was 21 years of age. And that's because of that curiosity and that looking for potential and solutions. Like you said, I've worked as an academic, professional leader in many, many different roles. But what's always been key for me is that I've only ever worked by and for community well-being. Love my career. As an advocate of social justice, for psychological health, for systemic change, I just get really passionate about mental health reform and contributing to having a healthier society. There's so much more that we can learn and so much more that we can do. That fuels my fire.
Can I ask, how's your international experience shaped this vision for mental health reform here in Ireland?
Yeah, so most of my experience, I would say that I bring from Canada, Australia, and the United States mostly. And I'm very, very privileged. I feel very privileged to be both an Irish citizen and a Canadian citizen. One of the things I've learned across 5 or so decades is that as humans, we are really all the same. We are very, very resilient, but we're also really susceptible to suffering. So fascinating for me. Culture has a real impact, but context. I like talking about context. The context that we're in tends to make the biggest difference.
What was the context in Canada that you saw that's different to the context in Ireland?
Well, some of my bias or experience comes, of course, from my own lived experience. And a lot of that would be with Indigenous community and in really rural and remote Canada. So then those become contexts where I saw a difference. Not that that doesn't recur in similar ways in Ireland, in countries all over the world, but those in particular shaped my views and experience of how context changes things.
Mm.
It was absolutely a privilege over the course of my lifetime to work with Indigenous communities and for Indigenous peoples. So, I mean, in that, I was able to bear witness to the most beautiful cultures and communities in extreme resilience, despite, or maybe even slightly because of, generations of cultural oppression and a history of cultural genocide. So back to seeing that, with that resilience and the suffering that can occur in those kind of contexts. And then if I shift gears somewhat equally in some ways, when you're in a really rural, I'm from a rural farming village, St. Bride's specifically, the Irish community tucked into Western Canada. There's a really protective blanket from being in a very small community. But from a privacy perspective, it's also like being in a small glass fishbowl. Now, take those things together, separately or together. When communities tend to be harder to serve, they either have higher needs or there's less professionals in that area. A system response will very often be give them any service. Any service is better than no service. And so we've somehow benefited these communities. And that's a tautological argument. The opposite is what is actually true. The more remote a community, the more diverse or specific small a community is, the higher the needs, the higher quality of service that community deserves. It's not about equality because you can't always have equality, but it's about thinking about equity that comes from context and where people are.
And I'm sure giving those communities their own voice to say what they need at that particular time.
Yeah, absolutely. And that's where innovation is really key. One of the terms I love is outcome informed practices. We can't come up with an idea. This is a mental health service, so this serves everyone everywhere. Outcome informed practices are I'm using these practices or this service in this community and culture or context, and it works. I'm using it here and it doesn't. What do I need to do to tailor to the people I'm serving, not the other way around? We don't fit in nice, neat boxes. We're humans. We're messy. We don't use things unless we know they're working. And to know they're working, we have to pay attention to them and keep tailoring them for who we're serving.
I wonder, what do you think has held Ireland back from treating mental health as a true national priority?
And I don't have a crystal ball. But my guess would be very similar to a lot of other countries and governments and systems, competing demands. And decisions are made by elected officials. Democracies are very, very important, but they have very short periods of time in which to make important decisions. So if you're trying to make everyone happy, the basic rule is you usually serve very few people well. And so by that, I mean our most successful leaders, our most successful societies, communities, governments, those are the ones that really look at what do we need? What would give us a solid foundation, even when that's not something that's easy to do and it's not something with immediate results. So what do we have? We want to address social determinants of health. We want to have robust services. We want to have a really strong education system. We want to prioritize identity and culture. We want to build a really strong economy. That's a lot of competing demands, really. And very few of those could be done in one election cycle. Probably none of them can. So that interferes. Probably a third area that really interferes with our ability to make mental health a true national priority here at the most base level is that there is limited money for health. So cancer, heart attacks, there are medical conditions that really capture the human imagination. They get great support and they're often funded at a higher level than what they actually cost the health system or society in comparison to, say, psychosis or more profound mental health conditions. But we see this across many places in the world. When mental health has to compete with physical health, it becomes the poor cousin in that healthcare family, really. And we know mental health is so much more than just health, but the funding is really limited. Sort of a long-winded answer, but I think there's a few barriers or landmines that have been in our way of making it a true national priority.
Yeah, yeah. You may think it's a long-winded answer, but it's a very overpowering, overwhelming question to be asked. And you're right, like mental health can play like the poor cousin, but poor mental health outcomes will affect physical outcomes and life expectancy, and there's a direct link to that as well. That it's not as ethereal or something that's only whispered behind closed doors. Like it has a tangible effect on the body, it has a tangible effect on the economy. There isn't enough money in the pot could be the argument. But if money was spent at an earlier stage in the right place, it would save money down the line. And that kind of speaks to the idea of early intervention, which can apply for children and young people and across a lot of other demographics as well. And speaking of that, the government and like a turning point, we're coming into the budget season. Mental health reform has started work on our pre-budget submission, aptly entitled Pay the Bill. We're going to have a formal launch in the coming weeks, which will be the 18th of September. It's a very important time now in the mental health field. So I wonder, why must the budget 2026 for next year be a real turning point? And what would it be to commit like 10% of the overall health budget by 2030? What would that mean in practical terms?
Isn't that the goal? And it might seem very, very obvious to you and to I, and the benefit, the kind of people who are involved in mental health reform and are passionate in the area. We see this as a clear solution. The people making decisions may not always see how can we do that in practical kinds of terms, or how do we justify doing that? But for me, realistically, the economy is in a good place right now. And compared to many nations, it is. And it's never an ideal time, but this is when we can invest. And then in the long run, like you said, we will save money. We will have a healthier population. Our population will be better served. This is the time to do it. And it's not always just about more money. It's about sustainable funding and innovation in that. There are so many brilliant people with lived experience working in mental health, within government, representing organizations that collectively we can work together and ensure that 10% is spent better. So it's not just spending more, it's allocating and committing to health budget spending in ways that actually foster sustainable change. And there needs to be enough of it to do that.
Yeah. You're reminding me, though, this proverb rattling around in my head while you're speaking of, the best time to plant a tree is 100 years ago. The second best time is today. And when we talk about these plans, such as the National Policy for Sharing the Vision, a lot has been done, but a lot of the time the progress can feel very slow. How can the next budget ensure that these promises are finally kept, especially around expanding, I've already mentioned, like youth services or reforming outdated mental health laws?
And that's a great question, Stephen. National and government responses are supposed to be slow, and no one likes that. But in reality, it keeps governments stable and it avoids radical changes like those we might be seeing in some other societies or countries right now. Commitments, on the other hand, commitments that are acted on because they are set into budgets, because they are ensured in sustainable funding, because they are enshrined in legal reform, those become part of a stable future that we want to have, and a stable future that we could be proud of.
That it's an all of government focus on mental health as well could be an outcome where it's not just ownership, say, by the Department of Health, but every department realizes the impact that their decisions has on on mental health of the population as well, and to hold greater accountability.
Yeah, well, if you want to do a pop quiz, name one government department where mental health is completely unrelated. I can't, but maybe you can.
No, no. Yeah, impacts everything. And that access to mental health care in Ireland is still pretty uneven. Like we've talked about the rural differences that you saw in Canada, and they're still very prevalent here. We live in a very Dublin-centric universe. There are long waits and gaps in early intervention, specialist care, crisis supports. I could go on. What kind of sustained investment, especially in the staffing, the infrastructure, and the community services that we need, will make mental health services truly timely, accessible, equitable? What would be your feeling on that?
Well, I'm very supportive of those three pillars that really make a difference. So the first pillar is, of course, accessible services, services that are not incontested. They don't have wait lists. They're community based and they're responsive to needs. So accessible as that first big pillar. The second pillar would be effective services. Back to those things I love, evidence based, outcome informed, but also innovative because they're able to respond to what individuals, groups, families, communities need. So we've got accessible services, effective services. But the third key pillar, I believe, is inclusive services because we're diverse in so many ways, and truly strong societies embrace everyone and see diversity as a particular strength. So to invest in a way that those three pillars are fundamental, really well done, that won't just pay the bill, that will pay it forward.
From a student psychotherapist here talking to a psychologist, I'm going to use the silver bullet, the magic question in therapy. Okay, close your eyes, Judith. She's closing her eyes. Imagine this a year from now. Budget 2026 has come and gone, and mental health services across Ireland are finally providing timely, quality care and support for everyone who needs it, just as you asked. In your view, what was the biggest change or decision that made that transformation possible?
She will first have to dance around and celebrate. But putting that aside, I pull back out that crystal ball that I don't have, and I look back to what happened. And as a psychologist, I want to believe it was a combination of that evidence based practice, outcome informed measures, but that decisions were made on a values based decision making response. I'll try and explain what I mean. So the decisions were made because we know the evidence. Quality, accessible services support healthier communities, they save money and resources, and they build stronger societies. We know what's needed, services that respond to outcomes, so they're tailored to the people and communities that are being served. And the decisions were made not just because they make sense, which they do, not just because it would save money long term and health resources, which it would, but the decisions were made because we value mental health, because we value human rights, and because we value dignity, and we put that at the foundation of all decisions.
Judith, with your experience in psychology and leadership, for somebody listening who feels let down or invisible within the current system in Ireland today, what would you want them to know?
Okay, well, Stephen, with your permission, can I respond as if that's you, as if I'm speaking to you?
Yeah, yeah.
Okay. So, Stephen, that disappointment, that energy that comes from feeling let down or invisible within the current system, that's a natural human response, and it's there to teach us something. Perhaps to validate that this is not the way things are supposed to be. Perhaps to be channeled into activism or volunteerism to be part of change. Or perhaps to signal to ourselves how very important self care and community support are, particularly when we feel like we can't count on the system. But, Stephen, know that there are people and organizations and communities that care. For me, it is so encouraging to know that mental health reform has over 80 member organizations and thousands of individual supporters, all with the goal to promote improved mental health services across the country. We don't have the answers. We haven't solved the issues. But together we represent some of the most remarkable people and organizations working tirelessly for an Ireland where people with mental health difficulties can recover their well-being, live full lives of their communities, and achieve their right, the highest attainable standard of mental health.
Yeah, I guess I'm just reflecting on that. You know, when we kind of feel let down or invisible, like I can feel a lot of anger, frustration, being oppressed, being invisible. And that kind of comes down to like three things for me. It would be I'm trying to defend myself because I don't feel safe. I don't feel safe in the system or society that's overlooking me. There's a political aspect that I want to kick, scream, shout, and destroy. And I think that look, there's some systems there that need to be destroyed in order to be built up again in the right way. But also there's an act of love. There's a self-love and community love that I'm only angrier right now because I see the difficulties that marginalised communities experience in Ireland or the long waiting lists, and my love and compassion for them feels throttled or smothered. But that anger is coming from a place of love as well. So that kind of gives me some consolation. And you're right, these things are all telling me three different things in three different directions. But they're all actions as well that I can take in either direction, and they're all equally valid. So yeah, thanks very much, Judith.
None of us like feeling like we don't have control. So that's often when we feel unsettled, is we don't feel like we have control over something. So any little actions we can take that help us feel more in control, they don't just benefit us, but they can benefit whatever's underlying there in that system, in that process for the community.
You know, it's been great to have you on the show and get to listen and learn more about you and your path and what you can see as a future for Ireland. So I just want to thank you very much for your time today.
Thank you, Stephen. It's great fun.
And for anybody who would like to use your voice, you can visit mentalhealthreform.ie. Be sure to subscribe to our newsletter, follow our socials, and yeah, let's use that voice together.